Hello, am I audible? Let me just check from the phone once. Am I audible, everybody? Just 1 second. All right. Okay. Good evening, Arnav. All right. So, good evening, everybody. I'm Dr. Neha, your mentor and guide for PSM on Unacademy platform. So, am I just let me know if I'm audible and the slides are visible to all of you? Okay, so yes, it was good. Thank you so much. All right. Okay, so this is the second part of numericals in PSM. Just a little heads up before we start. I am Dr. Neha, your mentor and guide for PSM on Unacademy platform. As you can see, on any subscription on Unacademy, you can use my code Dr. Neha 10 and get a 10% off. For my lectures on Unacademy, you can refer to this link for an additional discount. You can go to subscription that I've mentioned in this link. Also, I'm starting a FMG batch course on 18th of October, which will run till 22nd of November. You can use code Dr. Neha 10 and get a 10% off for that as well. All right, my special classes happen every Tuesday, Wednesday, Thursday, Friday, and Saturday on Unacademy platform, 9 a.m. to 10 a.m. So you can join there also. We do a lot of MCQs, and YouTube sessions are Monday and Wednesday, 6:30 p.m. and Saturday, 1 p.m. Good evening, Surjit. Just a little heads up, we on Unacademy, we are running a FMG batch course also. PSM will be taught from 18th of October till 22nd of November. So you can leave your PSM on me. Every day it will be a 2-hour session. If you want to subscribe, you can use code Dr. Neha 10 and get a 10% off. Also, you can subscribe to batch course Operation NEET PG 2021 that we are running on Unacademy platform. Unacademy has launched. These are your wonderful educators who are going to teach you live there. Also, again, any subscription that you want, you can use my code and get a 10% off. Also, this is about the FMG batch course that I'm starting on 18th. It's a part of the bigger FMG batch course only. It's just that PSM will be taught from 18th October. Also, it's very simple. Just download the Unacademy app and enter NEET PG and you can take a subscription. Also, we've introduced iconic subscription where both Prep Ladder and Unacademy will be offered to you at discounted rates. And if you use my code, you will get a further discount. All right. Okay, so that was the little heads up. Now, are you all ready for the numericals of the day? So shall I give you, this is the first today, as I told you, the numerical is about epidemiology and screening. Today we have a lot of questions about screening. So let me see, this is the first very basic one. Start putting your answers, everybody. What is your answer? Let me see all of you start putting your answers. All right, Ankita, yes. Start putting your answers. The first question is very simple. I can see your answers, everybody over here. Good. So the first question is, for the calculation of negative predictive value of screening test, the denominator is comprised of. So we have asked you negative predictive value. So very good. Everybody is marking it correctly as of now. Good. Jivan, Manju, Arnav, Soumya, Subhanvita, Surjit, everybody. So this was the simplest question that could come from the chapter of screening. So I will just show you how you do it whenever you get a screening question. All right, again, your outcome is your disease or anything, whatever. It should be on the column side, right hand side. Okay, yes, no. And this side is your screening test result. Is it clear? So here it is positive or negative. Now this is A, B, C, D. Now I want each one of you to write in the comment section, what does A stand for, what does B stand for, what does C stand for, and what does D stand for. Come on, quickly. Let me see how many of you are able to mark that correct. What does A stand for? What does B stand for? What does very good, Manju? So A is nothing but true positives. All right. B is, what have you written? Let me see. Good. B is nothing but false positive. Okay, C is false negative and D is true negative. All right, you have to remember this. Now when we talk about sensitivity, what is going to be the formula of sensitivity? All your rest of the MCQs will be based on these formulas only, so you should go through them. All right, sensitivity क्या होता है? Ability of a test to identify correctly all those who have the disease. Okay, so put in the comment section how many have the disease over here, guys. A plus C. Okay, and ability and screening test ने कितनों में disease बताया है? A. So this is A upon A plus C. All right. What is specificity? The ability of a test to identify correctly all those who do not have the disease. So how many do not have the disease? Together B plus D. And screening test has identified how many as not having the disease. So that will become D upon B plus D. Very good, Soumya. Everybody, those who are marking it. Very good. Then you have positive predictive value. What is positive predictive value? Out of all those who tested positive for a screening test, how many actually have the disease? So how many have tested positive for a screening test? A plus B. And इसमें से कितनों को disease है? How many have the disease? A. All right, and what about negative predictive value? All those who've tested negative for a disease. So how many have tested negative for a disease? C plus D. Okay, out of this, how many actually do not have the diseases? D. Is it clear? So this you have to remember. Okay, so if we want to write it in true positive terms or false positive terms, ये क्या हो जाएगा? True positive upon true positive plus false negative. Okay, this will become true negative plus false positive plus true negative. Okay, and this is going to become positive predictive value will be true positive upon true positive plus false positive, and negative predictive value क्या हो जाएगा? True negative upon true negative plus false negative. Very good, everybody. Good, Sujit. So when I asked you this question, what was the correct answer to this? I asked you negative predictive value. So the denominator is true negative plus false negative. Is it clear? The first question everybody has understood. Good, I can see your answers over here. All right, now let's go to the second question. Again, a simple one. What are the true positives in a screening test? If simple this numerical comes, true positives in a screening test, what are you going to mark? Tell me. Quickly put your answers. True positives in a screening test is given by. Let me see how many of you are able to get this correct. True positive in a screening test. Very good, Soumya. Start putting your answers. Vaishnavi has given C. Manju is writing D. Soumya is writing D. Most of you are writing C and D. Now, what is true positives, guys? We just have to give the formula A upon A plus C. यहाँ पे देखो. What is true positive? It is just, they are asking you about sensitivity. All right. So, the formula becomes A upon A plus C. Is it clear, everybody? Okay, so this was the first very basic questions before we go to the actual numericals. ठीक है? Keep this particular figure in mind. You don't need to memorize it at all. Okay. Next question. Tell me the diagnostic power of a test is reflected by. Sorry, this is predictive value. Okay. Market diagnostic power of a test is reflected by. Let us see how many of you get this correct. Diagnostic power of a test is reflected by sensitivity, specificity, predictive value, or population attributable risk. All right, so I can see mixed answers. A and C में mixed answers आ रहे हैं. ठीक है, some of you are writing A, some of you are writing C. Now please remember, diagnostic power of a test is actually the predictive value. Okay, what is sensitivity? All those who have the disease, the ability of a test to point out those who have the disease. So this is true positive. What is specificity? Ability of a test to identify all those who do not have the disease. So this is true negative. Now, out of all those, who have been tested positive, how many actually have the disease is positive predictive value. So this tells us how many actually have the disease. All right. Therefore, this is nothing but the diagnostic ability of a test. Okay. Negative predictive value क्या बताता है? All those who've been tested negative, how many actually do not have the disease? ठीक है? Do not have the disease. So again, this thing is telling us about the diagnostic power of a test. Okay, so please remember, diagnostic power of a test is given by predictive values. Is it clear, everybody? Give me a thumbs up if you've understood this. Diagnostic power of a test is reflected by what is known as predictive values. Okay? All right, let's go to the next question for the day. Now we come to calculating the numericals. Okay, so I will give you some time. Do this question. A screening test was positive in 50% of diseased and 10% of healthy population. What is the specificity of the test? So come on, start marking your answers. Again, I've told you, whenever numericals come, your first thing has to be to remember the formula. Then think about how to approach that formula. So you have to make a 2 by 2 table if required. So let me see how many get this correct. A screening test was positive in 50% of diseased and 10% of healthy population. So what are you going to do here? Okay, you're taking time to calculate. Go ahead. I'm waiting for your answers. Anybody who's got the answer? All right. Yes. Good, everybody. Okay, Soumya's answer is here. She has written A. All right, Soumya, let's wait for a few more answers to come in. Okay. All right. Okay, let's see another 1 or 2 answers. Okay, Surjeet has also written as A. Subhavita, Noor, Rahman, everybody is writing A as the answer. Okay, let us see how this numerical works. Okay, everybody knows what is specificity. What is specificity? Good. Jia ka answer has come as B. Soumya has again given B. Siddharth has given B. All right, no problem. Let us see how to work on this. Okay. Now here what you have to remember, specificity. Specificity is ability of a test to identify correctly all those who do not have the disease. Alright, that means true negative. So always keep this disease on the column side and this will become yes and no. Is it clear? The first step is this. Then over here is your result of a screening test. Okay, so result of a screening test आप बोल सकते हो positive and negative. All right, now look over here. A screening test was positive in 50% of the disease. 50% of the disease means 50. Is it clear? And how many are totally diseased? Total diseased कितने हैं? This is also equal to 100. Is it clear? So total diseased हो गया आपके 100. Am I clear, everybody? All right. Out of this, the screening test was positive in 50. ठीक है? Read the next line. And 10% of healthy population. So 10% of healthy population means how much? 10. So healthy population means those who do not have the disease. So this is also 100. Okay. And 10% of healthy population में screening test came out to be positive. Is it clear? So this is 10. So this is A, this is B, this is C, and this is D. All right. How much will be your C? Everybody in the comment section, C कितना हो जाएगा? 100 minus 50. So this is 50. D कितना हो जाएगा? 100 minus 10. So this is 90. Am I clear how you're going to fill this table? Okay. Then we've asked you to calculate specificity. What is specificity? The ability of a test to identify correctly all those who do not have the disease. So what is the formula for that? How many do not have the disease? It is B plus D. Okay. And screening test ने कितनों में correctly identify किया है as not having the disease? D. Alright. So this is 90 upon 10 plus 90, which will be 90 upon 100. Okay, so your options were 0.5, 0.9, 0.83 or 0.064. So this will become 0.9. Am I clear, everybody? Okay, this was a very easy question. All that you had to think was that you just have to fill this stable properly. Okay, 50% of diseased. The disease total is 100 and screening test has given 50 people as positive. Okay, and 10% of healthy population. So just fill this, you will be able to come to the correct answer. Okay, let's practice a few more MCQs based on these numericals. You will get it right. Now this is a simple question that I have given. Calculate sensitivity and specificity of HIV of ELISA test in a population who are screened for HIV. So data is given. Now I want all of you to do it without paper and pens. That is how you will practice it. So start remembering the formula of sensitivity. What is the formula of sensitivity? What is the formula of specificity? Okay. Uske baad, let me see your answers. Good, Ankita, Arnav, Shashank has written. Another person has written. Sandela has written. Soumya, Jivan. All right, good. So everybody, you are giving the answer as C. Very good. Sensitivity kya ho jayega? It will be very simple. All those who actually have the disease. All right, so that will be 27. Ye kya hai? This is A, this is B, this is C, and this is D. All right, so 27 upon 27 plus 3 into 100. So this will become how much? 27 upon 30 into 100. So ye kitna aa jayega? You can calculate that. So this will be 90%. Okay, and specificity is how much? It will be 95 upon D plus B plus D. So 95 plus 5 into 100. So this will become how much? 95 by 100 into 100. So this will become 95%. Okay. So this is the answer. All of you should have done it without pens and paper, although I am showing you here writing. But since they do not provide you pens and paper, please try it without pens and paper. Okay. Everybody got this correct now? Let's move to a slightly difficult, I would not say, a slight question which a lot of students ask me, and they are actually in doubt when this particular image comes as the question. Okay, so read this question with me. A graph showing curves of normal blood sugar level and diabetic blood sugar level is shown below. Okay? Some area is found overlapping in the curve. So those areas are C and D. All right, diagnostic cutoff point is, this is the diagnostic cutoff point. Okay, this is 120 milligram per liter. All right, okay, deciliter. What does shaded area D represent in the graph? All right, so I can see your answers coming. Now, how did you, how did you write that it is D is what I want to know. Yes, come on, let us see how many of you got this correct. Okay. All right, so I can see most of you are marking this answer correctly. Ab dekho, look over here. This is the diagnostic cutoff. Okay, good. You've put in your answers. Very good. Now, all those who did not understand, look over here. Diagnostic cutoff is 120. Now, all those people who are on the right, okay, all those people who are on the right side are people with the disease. Okay, so who all are with the disease? Can you tell me? It is A plus C. And all those who are on the left side, okay, left side mein jo bhi hai, they are what? They are people without the disease. Am I clear? They are people without the disease. So ye kitne hain? What are they? They are B plus D. Now people with the disease kaun honge? Actually, what is A plus C? They are nothing but true positive plus, yes, anybody, they are A plus C क्या हो जाएगा? True positive plus with the disease जिनको बोला गया है false positive. Okay, and without the disease is B plus D. All right, so what will be B plus D? True negative, and what else is it going to be? False negative. So this small portion D represents false negative. Am I clear? Everybody understood how I've taught you? Good, I've seen a lot of answers. All right, yahan pe all you had to see is, to the right of this diagnostic cutoff is people with the disease, which is A plus C. So with the disease, kaun se ho sakte hain? True positive, and of course false positive are also grouped as having the disease. Left side is people without the disease. So that is B plus D, which is true negative plus false negative. Therefore, this smaller portion D is false negative. Just like smaller portion C is false positive. This came in NEET PG once or in AIMS paper, some paper. Are you clear with this? Can we go to the next MCQ, everybody? This was an important question. You should know this. All right. So my next question over here is, out of 1,000 population, all right, out of 1,000 population, a screening test found 90 to be diabetic correctly. Then a gold standard test found 100 to be diabetic. What is the sensitivity? So let me see how many of you are able to mark this correctly. Out of 1,000 population, a screening test found 90 to be diabetic correctly. All right, and a gold standard found so many to be diabetic. तो आप कैसे करोगे? Let me see your answers. Good, everybody. Yes. All right. Okay. So let me see how you've done it. Good. This is an easy one. Out of 1,000 population, a screening test found 90 to be diabetic. That means this is diabetes. All right. And in diabetes, what is going to happen? Yes, no. Okay. This is screening test results. So positive and negative. Now, out of 1,000 population, which is total, a screening test found 90 to be diabetic correctly. So, how many are diabetic? And then a gold standard test found 100 to be diabetic. That means 100 is the total who are diabetic. Total population or number of people who are diabetic. Is it all right, everybody? Good, Ankita. ठीक है. इसमें से your screening test found 90 to be diabetic. All right. So what is the formula for sensitivity? Quickly tell me. Ability of a screening test to identify correctly all those who have the disease. So how many actually have the disease? 100. Which a diagnostic test has already told us, and screening test identified it in 90. So what becomes your answer? 90 by 100. Is it clear, everybody? Give me a thumbs up if this is clear to all of you. You just have to make this thing, and yahan pe you do not need to fill A, B, C, D also, because they've just asked you sensitivity. So see, a gold standard is telling the test to be found positive in 100. So this A plus C is your total 100. Okay, A plus C is 100. Out of this, screening test has found positive in A, which is 90. Clear, everybody? Let's go to the next question for the day. All right. Now tell me whatever you can understand from this question. Carcinoma CA 125 is a marker for screening of ovarian cancer. ठीक है? Specificity G1, it is the ability of a screening test to identify correctly all those who do not have the disease. That means true, negative. ठीक है? Which I've shown you in the previous slides as well. All right. Now let me see how many of you are able to mark this correct. CA 125 is a marker for screening of ovarian cancer. To characterize this test, histopathological confirmation of ovarian cancer was done in a cohort of patients. 60 out of 100 women who tested positive for this test actually had ovarian, and 20 out of 100 women who tested negative actually had ovarian cancer. So I'm asking you, what is the negative predictive value of this test? Okay, so I've already got some answers. So remember the formula, and then over here you will write ovarian cancer. Okay, so ovarian cancer mein kya ho jayega? Yes, no. Is it all right? Result of a screening test. What is it going to be? Yes, no. Okay. Now you will tell me what all are going to be filled as A, B, C and D. To characterize this test, histopathological confirmation of ovarian cancer was done. 60 out of 100 women who tested positive. That means how many tested positive? 100. That means those who tested positive, okay, those who tested positive is what? It is nothing but A plus B, very good, which is 100. All right, and out of these 100, 60 actually had ovarian cancer. Okay, so this is 60. Similarly, 20 out of 100 women who tested negative. So how many women total may tested negative? Anybody? Again, this total may women who tested negative is 100. And out of them, how many had ovarian cancer? 20. Is it clear everybody? Simple हो गया ये question. Then they ask you negative predictive value. So what is negative predictive value? It is all those who've been tested negative, out of them how many actually have the disease? So what is going to be your negative predictive value? Good, everybody has told it, has given it correctly. It will be how many are actually negative? 100. उसमें से कितनों को actually disease है? 20. Is it clear? So this becomes 20 by 100. Very good, Manju, Soumya, everybody, Anu, Jia. Good. I can see your answers here. Good. Did all of you understand this? This was a pretty easy question. You just have to, understand and fill in the boxes. Okay? Let's go to the next question. Now, this I have just given you because after this you have a numerical that follows on this also. If screening tests are used in series, then there will be increased sensitivity and decreased specificity, increased specificity and decreased sensitivity, increased sensitivity, increased specificity, or decreased sensitivity and decreased specificity. All right, so I can see Shashank has put his answer. Good. Manju has put his answer. Surjit has put his answer. Okay. Now, what do you mean by test applied in series? That means, what is the meaning of test applied in series, guys? Anybody? Test applied in series. Very good. So I can see B as most of you are marking it. Test applied, okay, in series means that when, if you have suppose diabetes, okay, we first apply an RBS. Okay, so when you apply an RBS, all those who come positive, all right, after applying the RBS test, my second test, okay, will be applied only on those who have come positive. Is it clear, everybody? Okay, so that is the answer, that is the meaning of test which is applied in series. All right, so you have to remember this, that first a screening test will be applied, then those who come positive, the second screening test will be applied on them. All right, so suppose RBS ka, let's just take an example. RBS ka sensitivity, if we say, is say 80%. All right, that means how many of them, how many will be taken out as true positive? 80. All right, now out of the second test that I want to apply is say FBS, but I am going to apply this second test on only those who have tested positive on the first test. So FBS will be applied only on this 80. Now suppose FBS ka sensitivity is 80%. So now the sensitivity will become 80 by 100 into 80. All right. So whatever value comes, you will see that there is a decrease in sensitivity. Is it clear? Okay, so when tests are used in series, there happens to be a what? There happens to be decrease in sensitivity, and since sensitivity decreases, your specificity is increased. Is it clear? But there is another way in which tests are used in parallel. So what happens when tests are used in parallel? Anybody in the comment section? That means if for diabetes, you are going to apply both RBS and FBS simultaneously. Okay, so iska sensitivity says 80%, iska is 80%. So total sensitivity combined, okay, when you apply it in parallel is going to increase. 80, all right, this iska kitna ho jayega? 80. So total sensitivity it increases 80 plus 80. Is it clear, everybody? And since in parallel kya hota hai? Sensitivity increases, therefore what happens? The specificity automatically decreases. You don't have to memorize this, just think. All right, now to make you think, try and do this question first. You will be able to answer and you will be able to understand. Okay, if the hemoccult test is negative for screening of colon cancer, no further test is done. If the hemoccult test is positive, the individual will have a second sample tested with the Hemocrit 2 test. If this second test is positive for blood, the individual will be referred for more extensive evaluation. So the answer is, the question is, what is the effect of net sensitivity and net specificity? Anybody? Yes. Come on, start putting your answers. I can see your answers also. Let me see how many of you get it correct. All right, I can see a few answers over here. All right, Vaishnavi has written, Soumya is writing C, Vaishnavi is writing B. First, tell me, this screening test is applied, whether it's applied in series or whether it's applied in parallel. If you're able to make out that, you will get your answer. Very good. Here we are applying the test in series. Okay? How do you know that? See, यहाँ पे clearly written है. If the heme occult test is positive, the individual will have a second sample tested. That means those whose first test is positive, they will only have a second test done. All right, so that means what? My net sensitivity is decreased, and since my sensitivity decreases, test in series, okay, sensitivity decreases, automatically my specificity increases. Am I clear, everybody? Because they are reverse. All right, did you understand this question? You have to find out whether whether the tests are being applied in series or they are being applied in parallel. Very good, Reshmi, Ashish, everybody has written the correct answer. Okay, now today's last question. Yes, Ankita, whenever sensitivity increases, all right, specificity decreases. जब sensitivity decrease करता है, specificity increases. And when you apply your test in series, like I showed you, okay, you are going to, first test is applied, those who come positive, in them only you are going to apply your second test. All right, therefore combined sensitivity decreases, like I showed you in the diabetes example. All right, now I'm waiting for this answer from everybody. Tell me, those who marked it quickly. Let's see how many of you get this correct. In a town of 20,000 population, total 456 births were there in a year, out of which 56 were dead born. The total deaths were 247, out of which 56 deaths were within the first 28 days of life and another 34 had died after 28 days. So calculate the infant mortality rate. Come on, I'm waiting for your answers. Very good. I can see some of the answers. Ankita, I hope you understood now. All right, good. So I can see Soumya has put her answer as B. Let's see, Indragni has put her answer as B. All right, good. Keep putting, keep putting. This is the last question. Raj Ravi has also put as B. All right. Now, whenever, please remember, you will get a mortality rate question definitely. What is infant mortality rate? It is number of infant deaths. Okay, number of infant deaths per 1,000 live births, isn't it? This is the formula of infant mortality rate. Okay, just a bonus question. What is the current infant mortality rate of your country? Put in the comment section. Let's see how many of you get it correct. So here, number of infant deaths. कितने infants मर रहे हैं? The total deaths were 247, out of which 56 died within first 28 days. So 56 plus another 34 had died after 28 days. All right. And how much is the live births? Total है 460 births, out of which 56 were dead born. So 456, remove the dead born, which is 56. All right, multiply it by 1,000. तो ये कितना हो जाएगा? How much will this come to? Anybody who's calculated? Very good. 90 upon 400 into 1,000. So when you calculate it, it comes out to be 225. Very good, everybody. The current infant mortality rate is 32 per 1,000 live births. All right, what is the current maternal mortality ratio of your country? Just a bonus question, quickly tell me. Current maternal mortality ratio. I can see a lot of people putting in answers. All right, what is the current maternal mortality ratio of your country? Start putting your answers. Very good. Manju, it's Manju, 70 is the target that we want to achieve according to National Health Mission. ठीक है? Currently it is पूरा बताओ 113 per 1 lakh live births. Is it all right, everybody? Okay. Infant mortality rate is 32 per 1,000 live births. ठीक है? And maternal mortality rate is 113 per 1 lakh live births. So good. I hope everybody has understood, and I got a lot of correct answers today. So I hope this session is helping you. Again, on Monday, I will come at 6:30 p.m. to discuss another set of MCQs. We will be seeing biostats numericals on Monday. Next week, Monday, Wednesday is for biostats numericals. Okay. Also, on Saturday I will have a live clinical quiz on YouTube. Okay, that those will be just MCQs for IIN, CT, FMG, mixed big bag of MCQs. All right, so I hope you all were able to understand this. Please like, comment, and subscribe to Unacademy. It's one of the best platforms for online teaching and teaching as a whole. We have a very good number of educators or brilliant educators who are there on Unacademy platform. So you can subscribe to the NEET PG courses, you can subscribe to the FMG batch courses, all right, and you can use my code to get a 10% off, because this is a very important time for all of you with all the exams approaching. And live quiz in Unacademy, usually I give it out at between 5:30 and 6, and at night around 11 o'clock. All right, okay everybody, thank you so much everybody. About rabies vaccine, okay, I will tell you, rabies vaccine, the same thing. Immunoglobulin, if given once, it will continue for lifelong. You don't have to give it again if the person suffers a bite. Okay, then if you suffer a bite within less than 3 months of exposure, you do not need to give anything, no vaccine. But if it's been 3 months, you'll just give 0 and 3 days. Okay, and for pre-exposure prophylaxis, give it on 0 and 3 days. All right, the 0 and 7 days, 21 and 28 days additional in pre-exposure is given if somebody is immunocompromised. Okay, I will take out the let me make a post today and give it out to all of you. All right, so this is where you can find me. All right, this is the various links. I'm on Unacademy over here. All your lectures you can access. Okay, definitely I will keep continuing this session. Okay, this is a very important session. And thank you, Sameen. And yes, G1, the series will go on. We'll keep practicing numericals every Monday and Wednesday at 6:30 p.m. All right. Thank you so much, everybody. I will see you soon tomorrow morning at 9 o'clock. Okay. All right. Take care and have a good day, everyone.